En 5 minutos. Well, welcome all to the colloquium at the Center for Complexity Science. It's my pleasure to present Yaneer Bar-Yam. I did a postdoctoral fellowship with him at the New England Complexity Science Institute more than 10 years ago. And he has been actively applying complex systems approaches to a variety of fields, including pandemics. So he's an expert in the area, and since the current pandemics began, he organized different efforts, and he will tell us more about what he has been doing and what we can do to stop coronavirus. Please, Yaneer.
Thank you, Carlos, and thank you. I think I want to actually start by talking about kind of the challenge of science. We've seen actually a quite prominent role of science in the response to the outbreak. There are epidemiologists that are serving as government decision makers. And as complexity scientists, I think there's something that I would like to explain that's quite important, which is that science and policy don't have the same criteria or conditions for our understanding of what it means to make a contribution. In science, it's very reasonable to create a hypothesis, an assumption, and to follow through on the logic and to derive conclusions, and to publish papers. They can be published at all levels, including the highest levels. But one of the things that happens when that kind of work moves over into policy is that the policymakers don't know to recognize that the assumptions may not be correct, and therefore the conclusions may not be correct. And so there's been a real problem with academics making assumptions and deriving conclusions, but the assumptions are wrong. And when that happens, lives are lost, and really in the last few months, many, many lives have been lost because of incorrect assumptions that have been entered into the policy dialogue and created confusion about the nature of what's happening in reality. It becomes a false choice, right? Policymakers have to decide what to do. And their decisions determine, many times, it's often hidden from our view, but in this case, not at all hidden, they determine people's lives, whether people live or die. And when that's the case, the science can be done, the tools of science can be used, but they have to answer to a different condition, that the assumptions have to be verified. We have to understand the nature of the assumptions and validate them in order to be able to obtain policy decisions. And unfortunately, that hasn't been done in many cases. What I want to do is talk a little bit about a complex systems approach to understanding what is happening now, what has been happening, and to sort of guide our thinking. But eventually, what I want to get to is the place where we say to ourselves that while as scientists we may have what to contribute, we ourselves have to adapt to the current circumstances and realize that there is an imperative to act in this context, to play a role in what is going on as individuals, as a community, and that the major problem that we're facing today is a failure of decision-making, a failure of leadership that is partly responsible because of the errors that I've told you about, misguided information that has been provided to policymakers. But regardless of what the reason is, at this point, we have failure of leadership. We may be able to communicate effectively to leaders and change decisions, but we also have to realize that ultimately the action rests in the hands of people, in particular in the communities, and engaging with our community and helping other people organize to address the horrendous challenge that we're facing is really kind of the point of what needs to be done. So I'm happy to take a lot of questions. And Carlos, it wouldn't be bad for you to take questions as we go, but let me start by articulating how complex system science approaches problems and why this helps us in this context. So the first statement is that when we have a very highly complex system, and the world is a complex system, societies are complex, diseases are, all of the things that are relevant to what we're talking about are highly complex systems. It's very hard to understand what's going on. And why is it hard to understand? Because there are many, many things that one can talk about. There are lots of details in what's going on. And in this context, there are two things that don't work well. One is to try to create a very simple view of what's going on, and typically to understand it in terms of something else that we've experienced before. We put it in a category, like people say, hey, it's like the flu. That's a real problem because that carries with it lots of associated information that is not necessarily true. The second idea is to go into lots and lots of details. So details upon details upon details upon details. And therein lies madness, right? You can never get all the details. And so it's not a very productive way of thinking about what's going on. So there's an approach that's been developed as a fundamental tool of complex system science. And it's built on methods in physics that were used to deal with phase transitions like boiling of water or magnetic transitions. The technical mathematical side of it is called a renormalization group. And if you want to see a paper that I've written to explain kind of the ideas, there's a paper called Why Complexity is Different. Let me type it here. Why complexity is different. And there's a little bit longer piece called From Big Data to Important Information. And you can find these online. So basically what it says is that by figuring out what are the most important or what are the important things to know about, we can make progress in understanding highly complex systems. We don't really have to look at all the details, but we can't leave out the things that are very important. And so what I want to do is to give you a set of 3 things that are the most important things that we have to know. And I'll talk about a couple of others that are part of those. So the first thing that we have to know is that the disease is a terrible disease. And there's a fair amount of confusion. I said, people talk about it as being maybe not, different from some other disease like the flu, but it's really wrong, right? About 20% of cases that are identified end up in hospitals. They're very severe cases. Um, uh, and of the total of cases, about 6%, if there's intensive care to provide it, end up on intensive care. And the numbers now are actually even higher than that. Roughly 5 to 6% people die. And if you don't have hospitalized sufficient hospitals, you end up with somewhere around 12 or 15% of people who are dying. And the other thing is that the disease is a terrible disease. It eats your lungs, it eats your insides, it affects the blood, it affects organs, it affects the brain. The doctors that treat patients in hospitals say this is the most awful condition that people have been in that they've ever seen. There's recently a description of people who've gone through disease and how they experience it. It's terrible. It's horrendous. It's surely not something that we want either to experience or to have our loved ones experience, family members, friends, or anybody. Even the cases that are so-called mild, there's a lot of indication that there's long-term damage. We don't understand it yet because it's only been around in our world, in our human world, for several months. But there's a lot of long-term effects that we don't know, and there are effects on children. Many children have actually severe cases. They tend to survive, of course, much more readily. But again, there's long-term damage, and there are all kinds of things that are happening. So it's a terrible disease. That's number one. Number two is that it's really fast when extreme actions are not taken. And this is consistent across many countries. There is a trajectory that all countries are following. If you look at the plots of all countries together, I can give you, maybe it's helpful to give you an example of such plots. But if you look, all countries follow the same trajectory until they take extreme action and they exit the mainline trajectory. That mainline trajectory is about a 10-fold increase in cases per week. So it's an exponential growth multiplying by 10. So you end up with, if you start with 1, there's 10, then 100, then 1,000. And we know as scientists that that's a very hard thing for people to understand, because it seems to be not present, it's very small, and then all of a sudden it's overwhelming. And that's what an exponential does. By the time you see that it's overwhelming, by the time that it happens, it's growing so fast that you're always seeing, of course, the tip of the iceberg, right? Because there's a lot of tests that are not being done, and there's an incubation period of up to about 2 weeks. So it's kind of, you don't see you only see some fraction of cases because of testing, and you only see the cases that are already manifest, but the cases that have already been infected is another factor of something like 5 over the cases that you see. So roughly speaking, there is a factor of, 20 to 100 of additional cases that are not even seen at any particular time. Horrendous. So really fast. The third thing that we all need to know and understand is that it's possible to defeat this disease. And this is something that is the most important thing that policymakers do not understand. And the ability to stop the disease is in the fact that we understand that the disease survives by transmission. If we stop the transmission, we can stop the disease. It will go extinct. And this has been done now. We have been keeping a track of a count of countries, and I can give you a link so that you can look at this on the website, which we've developed for fighting the disease, which I'll tell you about in a minute. There are 49 at this point countries that we have on the list of countries that have really defeated the disease. And there are tens of others that are close and among the countries that have defeated it includes Greece and Norway, as well as Thailand and um, New Zealand, and so on. So there are a whole bunch of countries that have defeated it, and among the countries that are nearly there includes, Germany and Italy and Spain and Ireland and so on. So, many of the mainline sort of European countries did not take action early, so they're not defeated it yet, but they're pretty close. They're on a trajectory. They've opened up a little bit recently, which is a problem. We'll talk about that, but they have a good chance to eliminate the disease. So how do you eliminate the disease? Happens because we know how it transmits. It transmits basically through breathing the same air, coughing and sneezing, and breathing out air from one person, other person breathes it in and gets infected. Also surfaces, you can't touch surfaces because they're contaminated by either touch or by the fact that people breathed out and particles fell on it. So how do you avoid it? The answer is, first of all, don't be in places where other people are or were, because the stuff stays in the air for hours. So if you walk into an elevator, someone was there an hour or 2 hours ago, you can still get infected. In common shared areas, you don't want to do that. And you don't want to touch surfaces, maybe with gloves or maybe with a piece of paper or something like door handles or elevator buttons or and so on. So being careful not to breathe in air that other people breathe in. So people talk about 6 feet as a distance. 6 feet is not nearly enough really to protect. A sneeze goes 27 feet. So let's say, 18 feet is good. Outside is better than inside with moving air. You want to stay away from people with a 18-foot distance. Maybe you can talk to someone for a little while. Walking by someone, maybe a little bit closer, but you surely don't want to be around people for a long time if you have a whole bunch of people in the space. So that's social distancing. Of course, the strong version of that is stay at home. Of course, one can go out if one is alone, right? But basically stay at home. And then there are a few other things that are really important. And all of them are about just stopping transmission, which we want to avoid anyway, because people don't want to get sick. We don't want to get sick. We don't want other people to get sick. So we want to avoid it. So one is wearing masks. Masks are filters. They prevent people from breathing it out. They prevent people from breathing it in. And that's really super important. And then there are a whole set of other things that have to do with regular daily things, like if people have to go to get groceries or go to the supermarket. So it's much better to do drive-by pickup, curbside pickup and things like that in order to avoid going into a space. As we said, it's not a good idea. If one has to go into a space, then masks and gloves and all kinds of protection, stay away from people at least 6 feet and so on, hopefully a lot more. So that's the self-protection. And then it gets to another level if there are cases that are identified. So if someone is sick and it starts from symptoms, if someone has symptoms, coughing, sneezing, and then there's a fever and there's shortness of breath, if someone has symptoms, you want to isolate them so they don't infect anybody. So a lot of the problem in many places that people are isolated at home, with family, with roommates, with housemates, not a good idea. I mean, maybe if you have a mansion with, separate bathrooms and wings of the house and so on, it might work. But in general, it doesn't work very well. So you want to separate people someplace else. How that works is requires community effort. The traditional, we'll talk about this a little, the traditional way to isolate people is for communities to arrange for isolation places, separate buildings, whatever it takes to make sure that people are not go to get infected. RVs, any idea you have about a space that people can go that they're not going to infect other people is really important. And then in addition, because people can infect others a little bit before they show symptoms, the people that they live with or the close contacts, or maybe a friend they went to visit, and this is what contact tracing is about, what you want to do is have those people quarantine for 14 days. So they have to also be isolated for 14 days. Now, the people that are isolated, they may be able to be with people who are also sick in the same space. But the people we want to quarantine, the people who might be infected, but you don't know, they have to be separated from each other. Now, I didn't quite say that correctly because I spoke about symptoms. And when someone has symptoms, we don't know that they're sick with the coronavirus infection, with COVID, because it might just be a cold. So how can we do this better? Well, we can reduce the number of people that we have to isolate and the people that we have to quarantine if we can test them. So testing is really important. The standard test that people are using is a PCR test, RT-PCR. It's a DNA test. And so if you can do the DNA test, you say, well, we know who's sick and we can isolate them and not the people who just have symptoms. And it turns out that that's not quite right because the PCR tests are about 30% false negative. That means they'll tell about 1/3 of the people that they're not sick, even though they're sick. And so now we have this problem that people get confused that they're not sick, then they go back to their families, they go work in essential services or whatever they're doing, and now you have more people that are infected. So that doesn't work. So number one, you have to be very careful about interpreting the results. So even early on in this situation here, people are getting tested. It's pretty clear from their symptoms that they had the disease. So they were told, hey, go to the next state and get tested over there. You get a different answer. So we have to be careful about interpreting the test results. Now, one of the things that I can tell you about is that it turns out there's a better test. And we've just today put out a paper on using CT scans. This was done in China. It's done in other countries around the world as part of the strategy for eliminating the disease is using CT scans at the initial time of symptoms because they show a pneumonia. And why don't people think about it in general? Because not all pneumonias are COVID. So what you do is you do the CT, you isolate people. That gives you the negative, right? You know that those people have a disease and might be COVID. And then you do the PCR test to see if it's COVID or something else. So using the two tests together, you can get way down in terms of the number of people you have to isolate. That makes it easier to do isolation and contact tracing. But then you have to get the medical people to do the CT scans. And we're pushing on them to do that, but we haven't been super successful in everywhere, but we're working on it hard. And that's why we put out the paper just today. So that's about testing and contact tracing. And the other kinds of things that we have to worry about have to do with really the important idea that everyone has to participate in doing it. So if the government tells people to do something and they don't, so they say, no, we don't want to do this, then it's not going to work. If the people, say they want to do something to stop the disease and the government doesn't help, it makes it a lot harder. But community is the most powerful thing. If people decide they're going to do it, that's the most important. But then there's businesses. So if you have your supermarket nearby and they're not instituting, curbside pickup, that's a problem, right? And if the employers are telling people to go to work and they don't have money, that they have to. So companies need to be on board. Community needs to be on board. The government should be on board. Everybody should be on board. And then we can get things done. And all of the community organizations, including religious organizations and non-religious organizations, everybody should be working on this to get it to stop. There's one final thing, and that goes back to this idea of what we call the relevant variables, the things that are mathematically the most important things. And we talked about that it's a terrible disease, that it's a rapidly growing disease, and that we can stop it. But there is a relevant variable that many people don't understand, and that's transportation. That's space, right? Because if people are very far away or just far away and there's no way to get from one place to another, there is no pandemic. There is no disease. And so for many years, we've been trying to explain to people about the important role of transportation and how we can use it in order to control outbreaks. And this is a traditional thing. You can look up cordon sanitaire. It's a French word, cordon which basically means boundaries. You create a wall and you prevent people from going from one area to another. Traditionally, people would put up a wall and then, whoever was inside it, they lived or died, right? That was their problem. But at least the disease didn't get other places. So this is not the way we do things today, and surely not as relevant to now. But every place that you can protect from cases coming in by setting up protocols, and there are 4 protocols that are needed. One is that people who are returning from someplace home, you do 14-day quarantines. People who are transit workers, essential workers, you set up special arrangements and cautions for them to come in. And then there's delivery of essentials, delivery of goods, food, other things into the protected area, but in general delivery. And the last one is transit. If someone has to get through one place to get to another, it's a good idea to let them get through and to set up special arrangements so that they can go through without creating contagion. So in any case, that we have to add to the other things. And I think I've covered almost everything probably. There are some things about, of course, making sure that hospitals are well protected, hospital workers are well protected with equipment, and they have the necessary resources to treat people who are sick. And also there's an importance to taking care of our own health, being healthy. Remember, there's this 80%, but the 80% that are mild, it probably depends upon how healthy they are, right? It surely does. So we know that. So if you make sure that you're healthy, you exercise, and you take care of the usual things, if you get a case of the coronavirus infection, like drinking a lot, eating well, soups are great, sleeping well, taking care of yourself, and breathing exercises, especially breathing fresh air, lots of fresh air. There are countries where there's a lot of fresh air and they've done a lot better in this disease, not because, they've done other things also, but fresh air is pretty clear that it helps. So that's mostly what I had to say. So here's kind of the summary. There's a disease that's terrible, that goes fast, so we have to act quickly, that we can stop if we do the right actions. I've taken some time to explain what the right actions are because I'm hopeful, and this is a major part of what I've been doing, that we can stop this disease by engaging with it directly, and that everyone here on this call will help. And so let me tell you a little bit about the background that I've had with disease outbreaks. About 15 years ago, we published our first paper on outbreaks, explaining why they have become much, much more dangerous because of global transportation. And it actually has to do with a phase transition, just like boiling water. It's not just that it goes faster from here to there. There's actually a transition that happens because the diseases that show up when you have a lot of transportation are worse and worse diseases, and they go faster and faster. So worse and worse diseases going faster and faster, that's a prescription for a phase transition and for disaster. So I was warning about that starting 15 years ago, and unfortunately people didn't listen very well. When Ebola hit West Africa in 2014, I was involved in talking to people at the policy level in the United States, so the National Security Council, at the UN. The head of the response effort is someone that I knew from other work, and we were talking about what to do. But eventually, as we see today in many places, government action is not always effective. So I got in touch through friends with people who are on the ground in Liberia. And I explained to them that what they were doing in waiting for people to show up in the hospitals and asking them who they were in touch with and trying to find those people in the community, in the cities, was not working, and that they had to go back into the community and to do find people in the community who had symptoms. And we were advocating for this, but it wasn't done. So I told these people who were on the ground, and they said to me, yeah, that's interesting. We started doing that 3 weeks ago. So the communities themselves took upon themselves to have teams going around door to door and checking for fever and isolating people based on symptoms. Now, not everyone did it. It was 50% of people did it, but for Ebola, that was good enough. And the disease went up exponentially, went down exponentially, and we got the disease extinct. It's a terrible disease. It was 10 times as many cases and deaths as any time previously. About 10,000 people died. But the projection by the epidemiologists, remember the epidemiologists that I was telling you about that write equations with assumptions? They were saying that there were going to be 10 million people dead. And the main thing that they assumed was that people wouldn't take action to stop the disease. And I was arguing with them, but it wasn't helping very much. But when the people did it, instead of having 10 million people dead, there were 10,000 people dead, which is a lot better, 0.1%. So I got involved in outbreaks in DRC, in the Congo, and I was working on community response in the Congo up to very recently in order to stop Ebola there in a couple of newer outbreaks, recent outbreaks that have been stopped. And now when the coronavirus happened in January, I put out a note in the January 26th. We said, hey, watch out. We can stop this. We really have to stop this, take action. Unfortunately, not action enough was taken. And I'm almost done with what I have to say. But the bottom line is, we know that we can stop outbreaks. We've stopped Ebola. We've stopped what is it? The other respiratory infection in Asia. It's blanking on it right now. I'll remember it. And then we can stop this one. And as I said, there are many countries that have already stopped it. There are some countries that took action very early and never had a case, believe it or not. There are not very many of those, but others who got a few cases have stopped it. And now increasingly more and more countries with many cases are showing that they can stop it. So hopefully Mexico will too. And the answer is it's in the community. The communities have to decide that they don't want the disease, and communities that show that they've done it will serve as examples to others. So hopefully everyone will explain this to other people around and galvanize, and let's do it. Okay, we've got some time for questions. Carlos, please.
Yes. Yeah. Yes. Thank you very much, Yaneer. Yes, we have a few questions on the video feed. One of them is related to what you just said, in the sense that considering that epidemics are highly complex, what would be the appropriate action level, the policy decision maker, or we should focus on local decision, let's say on the community? And I mean, it's a bit tricky because at the end we need both.
Yeah, it's a both and Carlos, by the way, Carlos is also extremely knowledgeable about everything that we've talked about, and he can really help you understand how to take care of this and talk with him about it as well. I'm happy to be available, but really talk to Carlos. But the answer is it's a both and, as Carlos just said. Where there are policymakers that are listening and receptive, you talk directly to the policymakers and get them to help. But it's always a community. The community has to do things. And so even if the policymaker is on board, you still have to get everyone. In any democracy, the policymakers cannot stand away from where the people are, right? So the policymakers, what do they do in order to get to be elected? And the answer is they know how to be where the people are. So if the people move, the policymaker has to move with them. But for the policymaker to move the people is very hard. The best thing they can do is to stand up and say, hey, we have to do this. It's really important. Let's get it together and let's do it together. And that's really important because it's a deadly situation. And that's kind of important. And you have to tell that to everybody because everybody's a leader in this circumstance. So the most important thing to realize is that as you expand the network of people that are involved in stopping it, then everyone will become on board, including the policymakers. But that's kind of the order.
Yeah. And also, I mean, you mentioned that, let's say, safe distance would be 18 feet, which is about 6 meters, or better, 27 feet, which is 9 meters. And in Mexico and other cities, people have been trying to reduce the probability of contagion in public transport. And in Mexico, we've seen images of the metro still being crowded, not as crowded as it was, but let's say the Mexican government is suggesting a safe distance of 1.5 meters or 2 meters. And this varies from country to country. And I wonder, where do they get the numbers? Like, okay, how many people should we allow in a bus? Like France, they told, well, it should be like 20% capacity. And well, and how much do you reduce the probability of contagion with that?
Right.
And what if it's 50%?
Yeah.
So
Yeah.
it seems to me that it's just like, let's hope that it reduces the contagion probability, but we don't really know how effective will it be, because anyway, we need to keep on with public transportation. Or in your opinion, should public transportation be suspended, or how, what alternatives there will be?
So there's one thing that I didn't say, which is that if one goes all out, if one really galvanizes everybody and goes all out, it only takes a few weeks to completely eliminate the disease. And it almost doesn't depend upon the number of cases that you start with. There's a particular trajectory, right? There is a trajectory that happens because of the underlying rate of contagion on the way up. And on the way down, if you look at the curves, it's about the same. But it can even be very fast. And the reason it can be very fast is that if everyone is isolating for 2 weeks, then basically everyone that's sick. And if you were to isolate everyone at that point that is sick, that has symptoms, then basically there's no more contagion. So it's kind of 2 weeks, but say people are with their families, so then you need another 2 weeks to isolate those people. So roughly speaking, you need 4 or 5 weeks, maybe 6 weeks, and you get rid of the disease. So if you have the choice, then you shut down everything, transportation, everything, and you say, okay, let's get rid of it. It's only 5 weeks, right? I mean, then we go back to normal. We don't have to deal with this disease. Now, the part of the problem right now is everyone's trying to figure out how to be clever and reduce the transmission somewhat enough, kind of, so it doesn't, and the problem is, we don't know, it would go up this way, go down that way, go this. So the first and most important thing is surely to stop super spreader events. So public transportation is a way for super spreader events to happen. Now, if everyone's wearing a spacesuit, then it doesn't matter. They can be right next to each other, right? So how much protection do you need in order to allow what distance, right? And so, masks, shields, protect your ears, use a coverall, so, if you're almost in a spacesuit, maybe it's okay to be, 1.5 meters from someone. I don't know, because we don't really know how careful people will be. But the point is that taking extreme precautions has got to be the right thing to do, because getting sick with this disease is a horrendous disease. So when you do operating at the population level, you have to think these things through. And again, outdoors, airflow, far apart from each other, So if you can not do those things, not go to public transportation, if you absolutely have to go to public transportation, people have to. I mean, I understand. Um, you know, um, shield, masks, coveralls, um, uh, the shield and the mask and the coveralls, if they're available, are not expensive compared to the risk. And then the question becomes, are they available? So hopefully now they're a little bit more available than they were before. There's another question here. Do you want to, Carlos, you want to ask?
Yeah, well, actually, it's related to what Anna asks about asymptomatic subjects. It's related to another question on the feed. That in Mexico, as I mentioned before the streaming, we've been doing in recent days about 7,000 tests per day, and we're getting, I don't know, 2,000 cases per day or more. So it's clearly not enough. But then how many would be enough? How much can we rely on testing? I mean, some countries have invested a lot in testing, like Iceland, and of course that's not the only thing they do, because if you just test and cannot isolate people who are positive, then what for do you test?
Right.
But so of course it's more complicated than that. But let's say the Mexican government has been using a so-called Sentinel system that it's used for influenza, and basically they take statistics of how many positive tests they get all around the country, and then they try to extrapolate how many cases there are, including asymptomatic ones.
Yeah.
What
But
did
let's
you?
talk about, let me talk about the asymptomatic ones first, because one of the things that people think is that because of asymptomatic cases, we can't stop the disease, because no matter what you do, you don't find these cases, and so they're transmitting. And the answer is there, what was it? The CDC just put out a paper saying that there are about 30% asymptomatic. Now, um, one of the things you have to understand is that according to the current mantra that is trying to figure out what's going on, the asymptomatic cases transmitted about 1/10 of what the symptomatic cases transmit. So if you take that and you take the 30%, it turns out that they're not really contributing very much to the disease. It won't stop us from getting rid of the disease. Now we know that already because there are countries that have stopped the disease, right? I mean, if there were all of these asymptomatic carriers that were causing a lot of transmission, none of the countries, zero of the countries that have stopped the disease would have been able to stop the disease. So we really have to get rid of that idea. The fact that there are some asymptomatic cases, it's a little bit more subtle than that. Remember, because people are using PCR and they're 30% false negative. So what you think might be asymptomatic cases are probably actually false negative cases that are transmitting the disease. So the actual truly asymptomatic, there's also a long tail to the incubation period. So people will start showing symptoms much later. The bottom line is the recent analysis of the asymptomatic versus truly asymptomatic cases. It's a very small effect. It's not going to stop us from eliminating the disease, and surely should not serve as a barrier to us stopping it. All it says is that if we have the ability, we should do more testing. Again, CT scans are better than PCR. If we can do testing of people that don't say they have symptoms but are high risk, like people that are working in high-risk institutions like nursing homes, prisons, any institutional setting, we should be testing the employees because they may be pre-symptomatic and we can catch them before they are symptomatic and they're transmitting the disease, or even if there are these things called asymptomatic. So I'm not sold on the asymptomatic, but even if they're around, we just have to be a little bit more careful about both testing and about isolation in order to stop the disease.
Yes. One final question is, if the PCR testing is not so efficient, could rapid testing have a effect of increasing infection because people say, "Oh, I don't have it," and then they don't take
I mean,
precautions.
you can easily imagine that actually doing more testing, the point is if people have a cough and they're afraid that they might have the disease and they start to isolate or they isolate themselves, then that's actually much better than telling someone you don't have the disease and then not isolating. And but the other piece of this is that it's not that easy to isolate. So people have to really take it seriously and isolate. So that if we don't have good tests, then basically what you want, I mean, tests take a few days to get the results back. So what you do is you test, and obviously you're going to isolate super carefully as much as you can before you get the result back. Once you get the result back, several days have gone by. If it hasn't just looked like a cold, really cold, so that you get over it very quickly, you still have symptoms or you're beginning to show shortness of breath or other things, then you basically go and do another test. So the bottom line is you don't trust the test unless it's already obvious that you don't really have the disease, and just really be careful. And again, being careful is what this is all about, and isolating everyone that has symptoms, for as long as reasonable, because the disease can be contagious also after you stop having symptoms, is really the way we stop the disease.
Yes. And one final thing, if people want to contribute, how can they do it? What could they do with the end coronavirus?
Sure. So a couple of months ago or so, maybe a little bit longer at this point, when I saw that the people here, policymakers in particular, were not stopping the disease from getting here, right? Travel restrictions would have been the right way to do this. I basically said to everyone, hey, we need to stop this. If you want to help, help. And that's how the End Coronavirus website was created. There's already a link to End Coronavirus to the countries in the channel, in the chat. And basically, there's a community of people. There's over 5,000 volunteers, different people doing different things. If you can do modeling, if you can do scanning for data, if you can do whatever you want to be involved. And if you just want to help us with communication, please just join. I'm the founder, but I'm not telling people what to do, really. I'm just trying to help guide the conversation, keep us on track. But there's a lot of people that are working quite hard, and we need a Mexico team. There is some effort already, I think, in Mexico. I don't have all the details because I didn't look before I got on the call, but obviously we need a lot more. And if you galvanize communities, a lot of what we're doing right now is interacting with specific, communities, right? So in a particular state, in a particular city, galvanizing people to take action to save themselves and their community, to get rid of this disease. And obviously, everyone you can bring on board, um, both professionally and personally. Again, family, friends, everyone's welcome to join in this effort.
Well, thank you very much. It was a pleasure to listen to your talk. And well, now the streaming will finish, but let's say we will stay in the Zoom channel, the C3 community, for let's say social hour we will have. Probably you're very busy and have other things to attend. So
let's talk for a few minutes. Yeah. So go
sure.
ahead.
Yeah. So Edgar, we can finish the streaming. Thank you.
Yeah. Okay, Carlos, I do have to go in a few minutes. Something is up. So is there something that I can help?